What is your movement quality minimum? How well do you move? Hi, Brian Schwager here, founder of the Wellness Movement Center. In today's video post, I'm going to be taking a short look at my athletic movement screen, and here we're using the functional movement screen to measure the difference between one side of the body and the other. In checking mobility and stability, what we're looking for is an imbalance or a difference between one side and the other. It is a well-known fact that the greater the imbalance, whether it be flexibility or stability, between one side of the body and the other, increases the client or athlete's risk for injury. And we're all about reducing that first, reducing our chance for injury. I do work with people who have injuries, and the assessment tests for them are different than what we're seeing here. This is actually the last bit of a test that I do for somebody who graduates from a more difficult set of assessments. Here, this pushing pattern is quite difficult with his hands up by his temples. But when I put his hands down by his chest for a simple push-up, he comes up crooked. Not that bad, but that has to be cleaned up before he does any kind of aggressive throwing, pushing, or pulling against his body, because one side is working extremely harder than the other. In this inline lunge test, he gets a good score. For the functional movement screen, you can either get a rating of a 3, a 2, or a 1. Now, a 3 is perfect. One side to the other, no imbalances, posture's maintained, he just looks good. A 2 on each side, well, we need a little bit of work. We need some corrective strategies put in before we get to any real aggressive training. But a 1 on one side and a 2 on the other, or like in the squat test, if he had just gotten a 1, we have a lot of cleaning up to do in order to get that score up to a 3. Now, I have a ability or an inability rating for my core function test. These are a few of them here. Here we're testing the inner core, and he had the ability to activate the particular muscles I was testing. I was using a blood pressure cuff and a gauge to determine the amount of strength he had in his inner core. Here I'm pulling him away from the floor and checking it at a different angle. Your core works differently in different positions, so I check it in various positions because I want to make sure that he meets the minimum in all areas. What we're getting to in this video post in general is that we need movement quality minimums, just like we need minimums for high blood pressure or checking cholesterol in order to reduce our risk for heart disease. We have to have movement baselines in order to reduce our risk for injuries in the gym, in recreation, or just in general activity in everyday life. These movement metrics, as they are standards by which movement patterns are rated and scored for their quality and their symmetrical balance. So in today's post, we're really focusing on your movement quality minimums. What are yours? To find out more, go to www.wellnessmovementcenter.com. Thanks. Bye for now.